In this video, we'll be talking about how unresolved emotions can lead to poor health. We're talking about the type of emotions that do not allow yourselves to honor your body. This is part of a 14-part video series that explores how trauma, stress, and anxiety play a pivotal role in health recovery. Hi there, I'm Dr. Chanu Dasari. I'm a surgeon who specializes in reversing gut microbiome dysfunction and autoimmune inflammation. My technique for reversing symptoms in as little as 6 weeks has helped thousands of patients over the years and is called the Mind-Gut Immunity Method. And if you'd like to learn more, visit mgiclinic.com and request a discovery call. Now, many of you know my personal story. In my early 20s, I struggled with autoimmune disease and digestive dysfunction. And I was able to fix inflammation naturally using the same methods that I now use in my patients. But even after all these years, after my recovery from autoimmune disease and digestive dysfunction, I've still struggled with the anxiety and frustration. Why was I so sick? Why did I ignore the early signs? Why did I let stress take over? And more importantly, why did I deprioritize myself in these situations? These lingering questions were important ones for me to answer because they were at the heart of why I became sick in the first place. After working with thousands of patients over the years, I can tell you that the themes of trauma, stress, and anxiety keep popping up. So in the Mind-Gut Immunity Clinic, we've enlisted the help of a personal development coach to help create awareness for my clients to understand how anxiety, stress, and trauma play a pivotal role in autoimmune inflammation and digestive dysfunction. It's a mini personal development workshop, if you will, within the Mind-Gut Immunity Clinic that creates awareness around illness. Our clients work one-on-one with our coach, Virginia, who you'll see here today, to integrate new awareness and thought processes into recovery. I can tell you from personally working with Virginia over the years that this is a much needed addition to the Mind-Gut Immunity Academy. And from the positive feedback I've received from my patients, I know that this is something that can help others in their healing journeys. In this video, we're going to take a specific look at unresolved emotions and how they affect healthy recovery, and specifically look at these types of behaviors that create problems in your own recovery or your own thought processes related to your healthcare. Now, this topic of unresolved emotions, it's very interesting, right? Because it can work in two ways. A lot of times these sort of emotions are what causes like an illness. For example, autoimmune disease, digestive dysfunction. We see a lot of people with chronic inflammation, gut microbiome dysfunction, right? That's like everyone in our clinic. So a lot of unresolved emotions can cause these problems, right? And then the reverse is also true. When you're sick for very long, prolonged periods of time, it can also cause additional unresolved emotions. And this is even after you recover, right? I mean, some of our clients, I mean, they're recovering within weeks, days, even several months. And these are illnesses they've had for decades, years, right? Long time illnesses that were medicated, that were seen by, countless medical professionals. So these folks really sick for a long time. And we see that even after their sickness goes away, some of the things that cause the sickness are still there. And then some of the unresolved emotional aspects of the actual illness are also still there way past when people recover.
And usually that's related to our story, right? They recover, but they were getting something. It starts with an unmet need. Then we're not feeling well, probably getting either more attention or attached to that story of being sick. And then we heal the physical symptoms, but we didn't really heal the mental symptoms that were originated. And then we can then still carry those with us, even though our body gets better, because we're attached to maybe something we were getting out of that illness as well.
Yeah, and how do you see this playing out? Like, what are some of these, like, give me some examples of, these unresolved emotions.
Well, so the body is healed, but then you still have the emotion or the feeling of wanting love, wanting attention, and maybe that the sickness was getting you a little bit of extra of that, and so you got really adapted to that, and now your body's better, but that unresolved need for love, attention, communication, whatever, is still there.
Yeah. And when we're saying love and attention, we're really there's different ways of considering that. Like that can include things like getting paid at work, getting accolades at work, overworking yourself,
Yes.
overextending yourself, or even signing up for obligations that you don't want to sign up for, right? And I understand, and there's emotional states tied to this, right? There's these emotional states can be tired, it can be anger, it can be resentment, it can be, you know, like there's a lot of emotions that are tied to that too, right?
Yeah, frustration, inadequacy, self-worth. There's a lot of things that are tied to it that
Mhm.
even though the body gets better, could still be residually left there.
How do you identify what these are?
I allow the client to identify it with themselves through very powerful questioning and really digging deep and hearing and seeing my clients, which it may be the first time in their life that they've been seen where someone actually understands them. So really my job as the coach is to hold space so that you can be seen and heard in a safe space. And a lot of times people don't have that.
And we do have a systematic questionnaire, right? By which sort of guides the program, right? We have an entire module dedicated towards this sort of thing, like unresolved stress, anxiety, trauma, to help identify these issues as they come about. It's not something like, yeah, obviously there's a lot of inner work that gets done, but we're also assisting this whole process, which is really nice. I like that we have that tool, right? The trauma awareness tool, because it allows people within 8 questions to kind of like get to the heart and get to the the root of what's going on in a very fast way, I would say.
Yeah, and a lot of people, one of the biggest things I hear is I hadn't thought about that in such a long time. I don't even know what those needs are. So the depth of the questions really prompts people to think about things that they didn't connect the dots with that could be contributing to their situation.
Yeah, even, and I'll say this, even with my, like, I was dealing with autoimmune, like a whole host of autoimmune diseases all at once, frankly. This was almost 15 years ago when I was still in medical school. And I'll tell you, like, it's been a long time since I've had autoimmune disease because I was able to fix it in myself. But a lot of the things that sort of led to that issue are still persist even till now, right? This idea of self-care is a big one. This idea of am I looking after my unmet needs? Am I overworking myself? Am I overextending myself? These things all matter. And I think that knowing that upfront is actually a very important thing.
Yeah, I would agree. And the body was probably been signaling you this whole time. It's whether you're paying attention to it or not. Like, am I hungry? I should go eat. If I have to go to the bathroom, I go,
Yeah.
and I think our body tells us those things and we ignore them because of our underlying beliefs, which can then lead to the physical sickness.
Yeah, even now I'm like, it took the birth of my child to realize some of these things that, there's these emotions that I was certainly ignoring and were unresolved, and
Mhm.
these still persisted. And these sort of things, when they play out in your head like that, it's like it's very important to kind of know how these things impact health, I think. I mean, like that, even when the health issues are resolved, and we encounter this a lot, right? Because we get people better in about 6 weeks, and these are people that have been sick for like decades, right? And we get through a lot of this inner work. We're doing all this inner work with them at the same time, and we try to get through a lifetime of crap. And even after they get better, some of these things we've seen sort of persist, and they kind of like they'll make their way into conversations with me or to you. And we
Yes.
have to say like, hey, like this is something we talked about, right? It's still like kind of playing in your head, right? And another one is like this a fear of being sick, like even to this day, I'm like looking at like what my bowel movements are doing, or I'm looking at all my symptoms. I'm like, examining my skin. I'm watching my weight. I'm keeping track of my my carbs, my fats, my proteins, my phytonutrients, my supplement protocols. Like these are all, and I'm getting my blood tested. It's like this
Ah,
hyper awareness, but and it's not like I'm sick. Like I'm perfectly fine. Like
yeah.
there's no issues, right? But this idea that you have to stay on top of things is partly motivated by fear, right? At least for me, because like I have I have for a very long time. I would think that I have like my next sickness is right around the corner, right? Like this whole thing's gonna fall apart and I'm gonna feel unwell again.
So, part of that is the thing that nobody wants to hear is that you betrayed yourself for so long that you still have not built up trust within you
Yeah.
that you're going to take care of you. And people have to look at that, because when you ignore your feelings of having to eat or go to the bathroom, your body starts to realize you're not going to listen to it. And so I think those fears come from not really honoring your own self and betraying yourself for the expectations of the job, the money, because you have these core beliefs that that's more important than your health.
Yeah. And I agree with you. There's, I'm in a given day, it's not like I'm spending 90% of my time on this stuff, right?
Right.
But,
Yeah.
maybe I should be. Maybe I should be spending 90% of my time, like hanging out and exercising and spending time in nature and, hanging out with the kids and, doing whatever, needs to be done, because those are the things I want to do, right? It's like those are my unmet needs. Those are tied to these negative emotional states. That's where I need to be focusing my energy and attention on. And it's like, I want to say this, like, just because I'm a surgeon, just because I have already fixed my autoimmune disease and my digestive dysfunction, doesn't make me immune, or anybody really immune to this. It's a constant kind of like being aware, I think, helps, right?
Yep.
Being aware helps, and then knowing what to do about it helps, like restructuring your day around it. But some of these feelings, it takes years and years for it to resolve, even after you've made some of these changes.
Well, through the questionnaire, through time, in our awareness program, we really start to be able to identify a desire from a need. An unmet, there are some core needs like nutrition and connection with the others. And then we get to redesign our lives to make sure at least those core needs are being met versus our desires. I desire to make money, or we have to really identify that. So we're staying in tune with ourselves, mind, body, gut together.
Yeah. And I think and we're going to go back to the theme of awareness here, right? I think being aware of what these negative emotions are, labeling them and being okay with them, and then working through them, working through like why they are the way they are. There's a lot of value in that. And I really wouldn't have said this until, very recently, where, I've really, having worked with thousands of clients over the years and seeing these transformations happen. And I have a ton of clients who have literally nothing wrong with them, that just they keep coming to me with questions. They're asking about like little things, and I'm telling them, like, I understand why you feel that way, because I feel that way, right? Sometimes I have these little fears of things, and I just need somebody to help me get through it. And that's really what we offer, right? We have a coaching service. We have medical professionals. We have people that have successfully overcome a lot of these things, and it's nice that we're building a community around this too.
Yeah, that's the part that I love the most, because a lot of this is normal. Fear is normal. There's a place for it, but it's what do we do with it when we identify it? And then, having this program to coach you through that, because some people just, weren't taught it, or they're just not sure. But for me, I one principle I try to teach most of our clients is curiosity. Get curious about it. Don't panic. Let's get curious. Let's investigate. Let's ask some more questions so we can really uncover what is at the base of that.
Going in depth on topics such as these allow us to achieve uncommon healing. We already do a good job at solving gut microbiome dysfunction at the root of inflammation, and we make strides in trying to unwind the perspectives and behaviors that create illness in the first place. And that's how we achieve a lasting recovery. Now remember, we've got 13 other videos on similar topics, so if you found this conversation useful, be sure to check out the other videos. Also, share these videos with someone you know who's struggling with a health condition and doesn't know where to start. Sometimes just starting the discussion with them can help them change their perspective on illness. Lastly, don't forget to like and subscribe. And as always, I'm Dr. Chanu Dasari with the Mind Gut Immunity Clinic, and I'll see you next time.